Welcome to Let's Talk About Health, powered by Focus on Diabetes. Focus on Diabetes partners with accredited doctors to share education and new treatment options, world-class healthcare organizations to introduce new technologies and free screenings for diabetic patients, their family, and the community. Now, let's talk about health.
Hey everyone, welcome back to Let's Talk About Health. Today we are going to be interviewing Tammy Coffer. She is LPN. She's been an LPN now for over 17 years. She has experience in family medicine, plasma center, working as an LPN, internal medicine, urgent care, just a different variety of different areas that she's worked in as a nurse. So let's welcome Tammy Coffer to the show.
Hello. Hey.
All right, Tammy, why don't you tell us a little bit more about yourself here, please?
Okay, as some of you guys may know, my name is Tammy Coffer, born and raised in Waterloo, Iowa, 319 all day. But yes, I've been a nurse, like she stated, for about 17 years. I come from a family background of nursing. My mom been one probably for over 25 years. Also, I have two young men, two granddaughters. And right now I'm living in Des Moines, Iowa, working at a plasma center.
Okay. All right. Well, Tammy, we're going to talk a little bit about she has diabetes as well as an autoimmune disease called myasthenia gravis. So you want to kind of get into a little bit of detail and kind of explain to us what myasthenia gravis is, along with different things that you've experienced, as well as having diabetes.
I sure can. Thanks. Basically, myasthenia gravis is a severe muscle fatigue disease and it affects all your muscles in your body. It's basically like how you walk or how you run or exercise. And let's just say your body is tired, is fatigued. It's 100 times that in a matter of just 10 minutes. So if I'm outside just walking to my car, immediately I can feel just heaviness. It affects your breathing, your talking, your swallowing, your walking, even just simple tasks like me just doing my hair causes me to go into exacerbation if it's not well controlled. With myasthenia gravis, with it being a rare autoimmune, a lot of people do not have it, but again, it's very common though. A couple people in Waterloo have it also, or just got diagnosed with it. I was around 25 years old when I got diagnosed.
So how were you diagnosed? Were you having some issues, problems, or just...
Yes. Yeah. Basically, I went to a couple of doctors. There was one doctor that saved my life, and it was my primary care doctor, and I love him to death. His name is Dr. Muchler. I had to just give him his shout out. But I was in nursing school at that time, and I noticed that I couldn't smile. I couldn't use my facial muscles like I'm doing now, and I couldn't cry. I couldn't laugh, and I started talking through my nasal cavity, and I couldn't swallow, and I kept choking, walking, and falling. My doctor would send me to all these specialists, and they kept saying nothing is wrong with you. So I guess they kind of figured that it was a mental issue. The last doctor I went to, they sent me to an ear doctor, and he said I just had a severe ear infection and I'll get over it. I left his office crying in tears, and when I walked out, I fell and I busted my head on the cement, and I just laid there, and I'm like, God, is this...
You didn't get up and go to the emergency room?
I couldn't walk, baby. I couldn't walk.
Nobody saw you? Nobody said anything?
My legs gave out on me. And I just laid there in tears like, okay, this is it. Is this how I'm going to die? Nobody here. Nobody's going to help me. And at that time, Dr. Muchler called me on my phone. He said, Tammy, where are you? I said, I'm right behind you to the doctor you sent me to. And he said, I need you to do me a favor. He said, I can come get you right now. Or if you can get up and get to the emergency room, he said, I think I found out what's wrong with you.
Okay. And I'm like, so okay. How did he get to that conclusion? Was there blood testing?
Yes. It was
imaging.
So I drove to the emergency room, and when I walked into the emergency room, there was paddles. You know how you bring, like, if your heart stopped, we're gonna bring you back to life. And I'm looking at them paddles like, what's going on here? He said, I'm going to run a test on you, and I think it's a acetylcholine test. And so basically, what they do is they inject you with some medicine, and within 15 seconds. you should feel back to normal, but it only lasts for 15 seconds. And he said, the only thing is if we give you this medicine, your heart can possibly stop. I'm like, oh, okay. You know what I'm saying? So he gave me the medicine and I felt like me for 15 seconds and went back to having those symptoms. So with that being said, they rushed me in an ambulance to Iowa City, University of Iowa, where they did a thymectomy. They removed my thymus gland in my chest because they said it had a tumor on it. I was there for a little bit. And then after that, it was constant battle trying to find what medicine works, high doses of prednisone and things like that. So it was a lot. It was a lot over the years.
Okay. So between when you were first diagnosed to now present, how long have you pretty much kind of like, you've been feeling like yourself, not feeling like yourself? Do you kind of go up and down? Are you just, stable at a certain point?
I'm going to be honest
does it just
with
kind of vary from time to time?
You know what? I'm going to be honest with you. Good question, Tiffy. With that, actually, I went to Iowa City. Iowa City told me that I would never get better. I went to Mayo. Mayo Clinic said, oh, you'll be all right. You got 5 years. We're going to get you in remission. From 2010 up into 2022, I was fine. I had a team of doctors behind me where I worked at that listened to what I was actually saying. They were, oh my God, they gave me the right medicine. So I've never had an exacerbation, even with symptoms like infections, trauma, stress, or anything will bring up these symptoms and make them more. So I had to figure out life-changing things to do that. So what pulled it out of me is when I moved here to Des Moines to open up a plasma center. But when I moved here, I kept getting sick. I'm like, something is wrong. Turned out that I got diagnosed in 2022 with diabetes.
Okay.
Yeah. So
with that, and how does that, how did your illness affect raising your kids?
Oh, wow. Dealing with that was very hard. If it wasn't for my village, when we say you got to have people behind you, my family, oh man, and my friends, y'all didn't allow me. They didn't allow me to be sad. They gave me my couple minutes, but then I had to keep pushing. I had to keep pushing to become a nurse. My sons, they helped me. There were times I couldn't put my shirt on. There were times that they had to help me put my clothes on. There were times that they had to wipe the tears from my face. So when I say that was a struggle, that was a struggle, but it made me even stronger because I knew what I had to fight for. I was fighting for them.
Okay.
I was fighting.
And with that diagnosis of diabetes, and did you say 22?
I got diagnosed here in Des Moines, 2022. And the way I got diagnosed was I wasn't feeling good at work. And I drove myself to the emergency room. By the time I got there, I almost passed out. I almost went down because I couldn't breathe. I started seeing double vision. And a key sign to my myasthenia is my eyes droop. So when they get to drooping, because I have no muscles to control them, that's how they know I'm about to have a flare up. And so that's when I got put up in there in the hospital.
And you said with the myasthenia, high doses of prednisone is one of the treatments, right?
Oh,
and you're diabetic, and we do know that sometimes with steroids that can cause your blood sugars to kind of like go all over the place. So how do you deal with when you're having an exacerbation, you're diabetic, you have to go on high doses of prednisone, kind of maintaining that balance to kind of keep your blood sugars and everything in check?
Wow. That is one of the hardest things about this autoimmune disease and diabetes. It's constant monitoring your intake of food. I mean, I got to the point where I was drinking water and my blood sugars was high. It's constant watching, logging, taking blood sugars 4 to 5 times a day. I had to stop eating my little snacks that I was eating, and I had to go with portion control. Now, you got to keep in mind, with us working on Focus on Diabetes all those years, I watched my A1C go up. I watched it constantly go up.
And so you went from non-diabetic, you watched it go up. So did you just not kind of like, okay, let me actually go in and get
not really. I'm going to be honest. I'm going to be accountable. Not really. But the doctor told me when I was diagnosed with high blood pressure, She told me, she said 9 times out of 10 in 5 years, she said, you're going to have diabetes because you're on prednisone. So it's going to be prednisone induced. I mean, genetically speaking, we do have it in my family, but I'm on high doses of prednisone. And what prednisone does is a steroid. It makes your sugars go up. So I can constantly just eat just a piece of chicken and I'm sitting at 300. So right now I'm on the steroid. Besides gaining, when I first got diagnosed, 100 pounds and just gaining weight, getting all the side effects of it, I have to constantly monitor what I eat, what I drink. You have to walk, even if you don't want to. Drink water before and after you eat, just enough to kind of, rinse the sugars out your system.
Well, kind of tell us a little bit about like this recent stint, because you said you're on high doses of prednisone now. You were recently in the hospital.
Yes, I was.
Even before that, what other treatments were all your treatments? Pretty much high dose steroids?
Yes, it was, because it's a difference when your myasthenia is acting up versus what is causing it to act up. So when you have an infection, trauma, or stress, they're able to treat me. As long as they take care of that infection, my myasthenia symptoms will go down. But if your myasthenia is flaring up and there's nothing else going on, they're going to hit you with some heavy hitters. So this last stint that I had, which probably was I just got out a week ago, I had knee surgery. Yeah, I had knee surgery. I had a torn right meniscus. And I knew, my doctors knew with me going under, with the anesthesia, with the prednisone that they were going to put me on, and an antibiotic just to make sure I don't get sick or nothing happen, that something possible could happen. After that, I noticed that I couldn't breathe. So my breathing was affected and I couldn't swallow and I couldn't lift my arms up. So I was immediately put in. And this time he told me what they discussed in the past. We're going to start you on IVIG. And I'm like, no, I don't want to do the IVIG.
Well, just tell us a little bit about what IVIG is.
IVIG is intravenous immunoglobulin. Is what they had to do the nickel, right? Yeah. So basically what they do is it's plasma. It's what I deal with. It's what I work with. So basically what they do is they give you antibodies that's going to attack the bad ones in your body and basically engulf them, so to make your body stronger, basically a reset. I have never had that in my whole entire life. And so by this time, with me not being able to swallow, fatigue, I'm scared. I had to make a decision whether to start this right now, because the side effects are blood clots, DVTs in your legs and things like that. And I just got out of surgery a week after that, so I could barely walk. So everything, I was just scared, but I wanted to get better. So we went ahead with that. So it was 5 doses daily of IVIG. That was something. That broke me down, because the side effects were like flu-like symptoms. So I had the sweats. I had the runny nose, stuffy nose, the bad headaches. I'm talking about migraines that you couldn't possibly even fathom. It was a lot, but I had to keep pushing.
Did it affect your diabetes at all? The IVIG?
Yes. It did. My blood sugars went up because I was still on prednisone. I'm still on it. So my blood sugars went up. And in the hospital, we all know how that food is. But they put me on a carb restricted diet. And
did you follow it? That is the question.
I ain't had no choice. I didn't have no choice. You bring me
okay.
So they put me on a strict diet. And it was, like I said, it was life-changing. It was life-changing. But I started to feel better. They let me go. But on the 6th day, they had to monitor me, and just to make sure that I was doing good. Still went home with symptoms. So yeah, right now I got a little bit. It's got to figure out how to do my hair. No shortness of breath. I can swallow now. Before, food was getting stuck in my throat.
All right. So how is everything affecting you right now?
Basically, like I said, the IVIG gave me a reset. I had to mentally and physically take a reset myself.
But how are you? Are you feeling like, we'll say 20, 40, 50?
I'm about 60%.
60? Okay.
I'm about 60% because with the IVIG, it peaks at 3 weeks once it's in your system. And
Okay.
a lot of people get it like every couple months, once a week or whatever. I'm praying that I only need this one dose.
Okay. Do you have any limitations when it comes to like your daily living, when it comes to your myasthenia and diabetes right now, or even in the past? We'll go from the past to even to now.
Honestly, um, the limitations I have is just the ones I put on myself. It's really situational. It's
Okay.
really how you view it. It's really like if you know that your body is tired, if you know, let's just say if you got a cold, a common cold, or if you got an infection and you know your body is tired, you relax. A
Okay.
lot of exacerbations don't have to be infections. It could just be fatigue.
Okay.
It just be so you just have to relax your body. It's just situational.
Okay. Okay. And
Mhm.
of course, everybody that's watching, please feel free to throw out those questions there to Tammy, and we can get those questions answered as well. Um, so you mentioned you got two boys and a couple granddaughters right
Yes, I
now.
do. My babies, yes.
Okay, how are things going with the family
Everything
and
is
after being in the hospital for so long and now being out of the hospital?
um everything is going very good. Um it's an adjustment. If it wasn't for my boys, I don't know where I would be. They have helped me take me to appointments and get me situated, bring me food. They have, oh my goodness, the things they have done for me. I'm just truly blessed. I can't complain with
Well,
that.
bringing you food, weren't you on a restriction?
Girl, he made sure he cooked. It was chicken breast.
Okay, just
You,
checking,
you
just
know,
double checking.
that's one thing about my kids. They won't move because I want them to. They'll do what's good for me.
Okay, perfect, perfect.
Yeah.
Um, so in the beginning, you said you went to several different doctors, and it felt like you weren't getting heard.
Yeah.
Some are saying, maybe it's mental. How did that feel? Having to kind of push through that and like push, advocate for yourself and all those type things.
During that time, it put me in a depression because I had to start questioning myself because I knew something was wrong. People assume if they physically can't see your symptoms, if they can't physically see that something is wrong, oh, I got pain in my stomach, that it's all in your head.
Okay.
So I got to the point where I started just pushing through it, even if I was sick, even if I didn't feel good. Um, like I said, with the doctors, a lot of people write you off, but you just got to keep on being persistent. I'm a
Okay.
persistent person. Somebody gonna hear me. So, like I
How
said with
many
Dr. Mutchler, he heard me. He bless his heart.
how many different providers have you kind of had to kind of go through this process?
Probably about 3 or 4 of them, and then I found when I went to Mayo. Mayo told me the team that I needed. They said you need someone neurology, you need internal medicine, you need your primary care. So when I got those doctors, those are the ones I stayed with until I moved to Des Moines. And they basically took care of me and helped me with my care. The thing is, when you move somewhere else, it's trying to convince another set of doctors that you know what
Mm.
you're talking about. So it's constantly trying to say, hey, you guys, I feel something coming on. Maybe you need to put me on prednisone. Well, no, maybe we need to figure out what's really going on. Or maybe we need, no,
Okay.
no, I'm telling you what's
You
going
know
on.
your
And then
body.
you know your body. So it's convincing the doctors that you actually know what you're talking about.
Okay.
To try in
And
order
how
to
does that work or affect with you being in healthcare for as long as you have been and you're a nurse having to kind of like, okay, don't try to brush me off. I know what I'm talking about. How do you kind of maneuver through that and how does that make you feel?
wow. I became a nurse because I felt like I wasn't being heard when I was younger. Or when doctors talk to you, they talk over your head. They don't talk, they don't get down and talk to you like, hey, okay, this is what's really going on. They want to use big words and things like that. And so I became a nurse when, I decided I wanted to be one because I want to be that nurse to talk to you like I'm talking to you to tell you what's going on. So when I had my team of doctors, they came to me and they was being real with me. But when I come here, it's different. It's different.
So do
So
you go in off the bat like, look, I know what I'm talking about. I'm a nurse. Or do you go in as that patient before even putting that out there?
I'm going as that patient because I want them to be able to I'm going in as their patient because I want them to be able to assess me the correct way. Now, I am a nurse, which is very true, but I also give them, I know how to be a patient. I know how to be a patient. I'm that one that's going to fight for you, and I'm going to be that one that's going to fight up against you if I have to, because I do know what I'm talking about. But when I'm telling you something and you're not listening, I'm going to the next. I'm
So
climbing
we
the
do got a
ladder.
question down there. So how long did it take to get your diagnosis and from them to figure out what was really going on from the time you were diagnosed?
Oh, you guys, it took about 6 months. 6 or 7 months. So by this time, I couldn't see, I couldn't talk, I couldn't chew food. I
Were
was
you
put.
admitted during that
They
time
didn't
or
admit. They didn't admit me until May. This stuff
yeah.
started in like November, around like November, and it was, yeah, progressively getting worse. I was in nursing school, so they tried to make it seem like um, it was the stress of being a nurse, or becoming a nurse, that was causing the symptoms. In fact, what make it so bad, I had my teacher that was teaching me at that time, because I couldn't really do the class. I came in there one day and she said, I don't know what you're doing here. She said, you're not going to be anything more than a receptionist.
Oh, excuse me?
She said, she said, you're not going to be a receptionist. She said, I don't see you. She said, something is wrong with you and you're barely here. And I'm like, we're trying to figure out. She said, no. She said, you really don't even need to be in my class.
You really don't know nobody's situation.
I know. And so I'm going to tell you though, when she said that to me, it didn't do nothing but push me even more. And what make it so bad, Tiffy, that same nurse where we worked at, that same nurse, she passed out at the hospital where we worked at. And I was right there, right by her side, and helped her get up, help her get situated. And she was like, oh my God, you're so attentive. You know what you're doing. She said, well, God bless you. Thank you so much. And I could have said, hey, I'm the one that you said wasn't going to be anything. I'm the one that you said was going to be a receptionist. But I leave God to fight my battles. There's no need for me to
Praise
tell you.
Jesus.
There's no reason for me to tell you what I'm capable of, because if you don't see it, it's not my job to convince you. So,
Oh, facts,
yeah.
straight facts. Of course,
Yes.
y'all keep them questions coming. Um, mentioning your how old are your grandbabies?
I got a 6-year-old, and then I have she's probably 24 days.
Oh wow.
Just
So
crazy.
with the 6-year-old,
Mhm.
does she ever, ask any questions like, Grandma, what's going on? How are you feeling? Things like that.
Yep, I have trained her. I have trained her
Oh,
at a young I have trained her at a young age. A lot of times she knows if Nani's blood sugar drops, what to do. You can even ask her. She'll know. I'm gonna get something to drink. If it's too high, what do you do? She needs to drink water. She knows where my machine is to check my blood sugars to make sure everything is within range. She even know the ranges. Look, we
oh,
don't sugarcoat nothing over here.
okay,
You know what I
okay,
mean?
okay. All
uh,
right.
because if she's with me sometime, or if I'm out in public and I'm with her, she know my snacks is in my purse. She
Okay.
knows my water is there. She knows how to take my blood sugar. She knows all that. She, yeah.
Dang.
That's how I had to teach my boys. That's how I had to teach them when I was sick. I didn't have time to cry, I guess, to really deal with
Yeah.
what was going on. I didn't. Because when you look around at your kids, who gonna raise them better than you? Nobody.
Well, let us know. Like, how important is it to talk to your family when it comes to your health issues, and different things when it comes to like your diagnoses and just letting everybody know like the plan, what's going on, and like just putting it out there for them.
Um, I believe it's very important. You have to be transparent. You have to be real. You have to be real with your family, and you have to be real with yourself. If there's a way, if you're feeling a certain type of way, then you have to let somebody know, because with myasthenia, even with diabetes, that stuff can come quick and it can knock you on your tail and you can be by yourself. So you have to let the people around you know. It's hard to tell people though, because when they
Why do
look,
you say it's hard?
because nobody's going. I feel that nobody's going to understand, that you're not going to get what I'm telling you, because you don't see me as being sick. And if I tell you I'm going down, or if my eyes are drooping and stuff, what would you think? You know what I mean? I can be at work and they'd be like, well, you'll be fine, or you'll be okay. Everybody wants to make it seem like it's okay, and it's not. So I try to deal with it myself. And then if it gets too bad, I'll let someone else know. It's it's hard having an autoimmune disease and then have to tell everybody what it is, that because then they'll put limitations on you.
Okay. Have you ever had any unresponsive low blood sugars?
No, thank God. No, not at all. I can actually I can feel when it's getting too low. But my lowest, a normal low for you, 110, you can probably operate at 110 and be okay. My 110, I can't operate at 110. I might get pretty soon, if you, I don't know, you can tell, like I said, my eyes will droop. My speech may be a little off, or I'm just like, man, you guys, I get real sweaty. And that's when everybody know when to kick in, or I know how to even handle myself. But I
So it
got
just kind of seems like your numbers are a little bit different with
hmm
having myasthenia.
your average is not my average.
Okay.
You know what I'm saying?
Yeah.
I was good, or I thought I was good when I didn't have diabetes. But when diabetes come into play and is not taken care of, you're going to suffer the complications of it. You're going to suffer, not only the myasthenia, but the complications of having diabetes also.
Are you taking any medications right now for your diabetes?
Yes, I am. I am taking metformin. I'm
Oh,
taking- yes, I am taking metformin once daily, and so a lot of that in diet control, watching what I eat. Like I
Have you
said,
ever had to, or do they want you on any type of insulins?
I did insulin in the hospital, 15 shots in my stomach 3 times a day for 5 days. Um, Probably even more than that. And then I had to take a blood thinner. That was also that I had to get shots for. So with the blood thinner and watching those things, yes. And insulin, they when I got in the hospital, they took me off of metformin and just put me on plain insulin. So my numbers they were high.
Hospital.
Yes.
So
So
how important is it to be consistent with your medications?
you have to. You have to. Your medications is what's going to help you to get better. If you don't pay attention and you think that you're going to get better without them, that's not the case. At least give it the foundation for what you need. A lot of people just on metformin for a little bit and be able to get their numbers down, their
Mm,
A1C, and then they're good. I say do that. You know what I mean? But with me, it's trying to get it's puzzles.
okay.
So it's putting them
So you,
together.
you mentioned that you are taking the you metformin for your diabetes. So
Mhm.
besides the steroids, the prednisone to help with the myasthenia, are you taking any other medications to kind of help combat myasthenia?
No. Well, I'm taking some called Mestinon. Mestinon is what I have to take every 8 hours for my symptoms. It's to prevent the muscle fatigue. I've been
Mhm.
doing that since 2005.
Okay.
Um, and like I said, just a prednisone, I'll be done with that tomorrow. And other than that, no. But God has blessed me because a lot of people see myasthenia as like I hate to say a death sentence. So diabetes too. They
Mhm.
see it as being real, real bad, but I've been blessed. I can't complain. I just figure out how to live with it.
Okay. And do you believe that autoimmune diseases come in pairs?
That's what they say.
So when they say that, what exactly does that mean?
They say usually when you have one, you got another one. Just it's hand in hand. They said that. They said that's what is written. Me, it, I'm not sure about that yet. Like I said, with me having myasthenia and just the genetics of the diabetes and high blood pressure and high cholesterol and those things right there. Yeah, I got all that. But it's a matter of just taking care of yourself, though. You got to take care of yourself. You got to be your own advocate. You have to be able to fight. You got to be able to fight. When somebody put a limitation on you, don't fall for that. The only ones that can stop you is the ones that you put on yourself.
Okay. So how important is it? Well, you mentioned family. You have your village, and what about your friends? And um, you know,
My friends rock. I love
Okay.
my friends. We have done so many things with each other as far as just health issues, health wise. You guys have been by my side. I had a good friend of mine. She was there from the beginning.
Not
She pushed
nice.
me to become the nurse, to become who I am. You know what I mean? If it wasn't for my girls, I got a circle, but man, I wouldn't trade them for the world. I wouldn't trade them for the world.
Okay.
Mhm.
That is awesome. Of course, questions for Miss Tammy Coffer
Ask me anything.
on autoimmune myasthenia, diabetes. You did mention your family history though of
Yes.
diabetes.
Yeah.
Did you were you talked to about that? Because they always say know your history, you know.
Yes. The
So was it told to you before, like previously?
My mom is the one who kept saying, "Take care of yourself. Take care of yourself. Take care of yourself." She was a nurse also, and she had a massive stroke a couple of years ago. And she said, "This is why I stayed on, you guys. You have to know your history, your family history, and you have to be able to prevent these things." I had a chance to while I was watching it go up. I had a chance to do right. Sometimes we have those precursors like the autoimmune or prednisone that's going to push us into them. You know what I mean? But you still have to pay attention. If you can prevent it, I'm all about preventative care. If you can prevent it, do right now. Don't wait to the last minute to where your toe finna get amputated or your knee getting ready to get amputated or you don't want to take advice from anybody. If you can prevent something, 100% do what you're supposed to do
Okay.
it.
You're right. I'm gonna start next week.
You
Um,
lying.
Tammy, what lifestyle changes can help
Yes,
manage the symptoms of myasthenia gravis?
yes. Basically know your body. Listen to your body. Don't let nobody tell you about your body. If when you're walking you're tired, sit down. If when you notice that you got some stress coming on or any signs of infections, go to the doctor. Go get treated. There's ways to handle that. You know what I mean? Again, I'm such an advocate for myself that I know them doctors get tired of seeing me coming because by the time on that third time, I'm
Well,
checking
yeah, I mean, you have
everybody.
to push, and then again, like at least let people know.
Hmm.
Um, Definitely watch, share,
Hmm.
like us also. Just let people know that push. Sometimes you just gotta push a little hard to some
You
of
do.
these providers and
Yes, you do.
staff to like,
Yep.
look, I know my body.
Yep. You got to because they ain't gonna listen to you if you ain't going nowhere. You know what I mean? So if they to the point to where if they ain't listening, you're gonna have to move me to get me out this door because I'm telling you that something is wrong with me. You know what I mean? And I figured I don't never tell nobody I'm a nurse because I don't want them to treat me no different from what they
Right.
would treat anybody else. I want the same care. A
Yeah.
regular person should be able to get in there and get the same care that I get.
Right. Does stress cause exacerbations for you,
Ye-
or could cause exacerbation?
Yes. Yes, it could, very much so. Um, when I came to Des Moines, it was to set up another plasma center, and that was a very stressful situation. Also, being the only nurse, or if I'm working, I'm the only nurse at the center,
Hmm.
and we're so super busy, my body will shut down. But I work where I work with a good team of people to where they can read me. I always let them know if something is wrong. So I got things written that my doctor wrote every 2 hours. Give her 15 minutes of rest. She needs to relax. You have to get those accommodations into play. It doesn't mean you have to use them, and it doesn't make you any less than if you have to.
Hmm.
The point is, you have to pay attention to your body. Don't let nobody tell you nothing else. So if you need that, you need it. You need it
Okay.
in order to make it.
Um, there was a question in there, but it just popped away. Okay. Are there surgical options for myasthenia gravis?
The one that I had, like when I said they figured, or before I had the thymectomy, when they removed it, they said a tumor was on it. They said tumor, when they remove it, that your symptoms will go away. So that's the only one I know of so far, but myasthenia is with you forever. You know what I'm saying? Can I
Hmm.
tell if it worked or not? I didn't have an exacerbation for over 10 some years until I moved here.
Okay.
You know what I mean? But is that because of the thymus was removed, or was that because I had a good team of doctors that trusted me to take care of myself? And once I got an infection, I would start that prednisone. You know, with the IVIG I had, it was going into my vein, but now I'm doing more research because I went on TikTok because I felt lost this last time. I felt,
Have you gained like any other insight or met any other
oh my
people with
gosh.
myasthenia?
Yes, in the group that I'm in on TikTok, the myasthenia gravis community, there's subcutaneous ways to give IVIG. There's so many different things that I'm just learning, and I didn't have to learn it because I didn't get that. My body wasn't that sick like
Right.
the first time. So I mean, oh my goodness, just overwhelming, and I had to find an outlet because I felt that what nobody gonna understand what I was going through because I wanted to tell them, guess what? I can't breathe. I can't, it's hard for me to take a shower. You know, I'm falling, or it's hard for me to get up. When people, oh, you be all right, keep going. No, see, you don't get it. So I had to go somewhere to where people that get it. And
Okay.
that's when I just started
Well, you
doing
keep
research on
pushing
it.
it and letting us know. You know what I'm saying? This is what's going on. Like you need to get it.
I know. I know sometimes it's just, it's hard though. People see the strong person. They're not used to seeing the one that needs
Vulnerable
help.
person.
Yeah, I guess that's what
So
it
do you
is.
just not like to show that when you going through different things with your autoimmune disease?
That might be a part of it. You know, it comes from how we were raised and the type of person I am. I'm a single parent. So I was a single parent, mother of two, my boys, 29. He's getting ready to be 30 in a couple weeks. And the youngest is 24. So I didn't have a choice when I had them. I had to keep going. You know, we started, me and another, one of my best friends started a basketball team. You know, it was during the time I got sick also, but I had to keep going. I didn't have a chance to focus on me. But now that everybody has their own life and everybody is grown and don't need me that much, I get a chance to step back and, like I said, reset and figure out me, figure out where I lost me and figure out some things. So,
Um, someone, can you share what a diagnosis or disease process like this has done for your spiritual walk?
so you got to keep in mind, I was already God fearing. I was already a God fearing woman. Susie didn't play that. I had to, when we're raised and we go to church because our parents make us. You know, you go to church, you're going to do this. I had to take this journey by myself, and I had to learn to trust in God myself. I knew everybody else did it, but I seen him work. You know, it's different. I seen him work in me and in others.
Mm-hmm.
So this journey with me, oh, we like this. You know what I'm saying? I'm talking to God. He's the first person I consulted about anything, any doctor. This last time I went in, I'm like, look, God, you got to be able to tell these people before I come through these doors in this emergency room, so I won't have to shut it down. But it was nothing but him. My journey is stronger. I trust him. When I
Have
say I
you
trust, it's a difference between saying it and actually living it. I live like I trust him, and I know I'm gonna be okay.
have you personally cared for any other person with myasthenia, and if so, how does that affect you mentally?
I have not. I um I have not. I know a couple. I know a couple people who have it, but we have not met up or did anything like that. But I speak to one of them. She had it. I think she was diagnosed before me, so we keep in contact. She's younger than me, also. I'm not sure if hers is a little worse than me, um, but I haven't had to care for anyone. But having myasthenia has made me the best nurse possible that I can be. I'm on that end, I'm on that patient end, but I'm
Mhm.
also on that nurse's end. So I know when I deal with people, even not with myasthenia, but in, you know, any disease or anything they're going through, I'm more compassionate. I'm like, I get you, I understand. I don't be quick to pass judgment at all. Because just because they say, well, I'm going through this, I'm like, just because I don't see it, you ain't going through nothing. No, it's like, I get it. I understand.
Okay.
I understand.
I got another one. What if your left eye gets blurry and you keep having headaches all the time, kind of going down your neck? Um, are those some other signs or?
You know, just basically symptoms like that doesn't mean it's myasthenia. A lot of people was wondering if it's genetics, if the autoimmune diseases are genetics. They say that they're not. I would say probably some different. And just back then we couldn't
Okay.
diagnose this because we didn't have the proper testing. As far as like the headaches, you can have a headache because of stress. It could be a nerve, it could be anything. All I'm saying is go get it checked. Don't let nobody minimize your symptoms, especially if you have a history. If somebody, I mean, just not MG, MS, it could be rheumatoid arthritis, it could be anything.
Keep throwing them out. What are some other ones? Keep going. Keep going. Keep going. Keep going.
Those are the main ones. Those are the main ones that I know. But you have to, like I said, first of all, go see a doctor. You at least should go get a physical. What is it, once a year? Yeah. Get your blood work done. A lot of people don't like to go to the doctor until they start getting symptoms. No, sweetheart, do it once a year. It's not going to hurt you. And if you have insurance, or even if you don't, I think those physicals once a year might be paid for.
Yeah. You just got to go and you got to push and advocate no matter what. Mm-hmm. If you know something's wrong and you know your body, then you just, you got to kind of advocate and push.
Mine, you said blurred vision. I had double vision. So I started seeing double too. Those were one of my first symptoms too, with the droopy eyes. So I would pass out. My first ones was I was at work and I passed out. That was the most scariest thing ever. Then I passed out in nursing school, but because I ate some M&Ms. Girl, I ate some M&Ms at nursing school, some Cheetos.
But yes. I mean, you did proper nutrition, right?
Yes. But yeah, that was 2005. I didn't know until I couldn't walk, until I couldn't talk. So that's why I said, keep getting that blood work. Everything is going to start to change. Just like my diabetes, the A1C kept going up, up and up. You know what I'm saying?
Blurred vision is one of the symptoms for MS.
Yep. Yes, it is.
So, I mean, because I don't know how many autoimmune diseases there are out there, but there are. They're there. Mm-hmm. So it's just a matter of, what did you say, Miss Coffer?
What? Advocating for yourself, going to prevention, pre-screenings, get to your physicals. You have to do that, y'all. I know a lot of people don't like doctors. A lot of people don't like blood work. But the way technology is now, a lot of stuff that you're afraid of, you don't have to go through that. You know what I mean? They're able to take, just with one tube, able to check everything.
Oh, what tube?
No, you better.
What color is
it? So silly. Go to the doctor. Just with certain blood work. But I'm just saying, get there. You get there, you check your body. You have to know your body, because you can't advocate for something that's not there. But if the doctors, they physically have something like, you know what? Okay, I see your A1C has been going up. You go back to them like, hey, I'm just not feeling good. You know what? Your A1C is not going up. Let's work on some dietary changes right now before you get to the point to where you have to have medicine. You got to have that doctor you can speak to. I think that personable one. And if not, keep fighting until you find one.
Okay. All right, look at that. Make sure you see your dentist too.
Yeah.
Because that can also cause some issues.
Mm-hmm. Man, I had to get my tooth pulled. I was about to pass out when I had it. When I had a tooth infection, which actually made my myasthenia worse in my upper part. So again, my eyes were droopy and my face was almost like a paralyzed. Like I could smell.
Oh, it didn't swell? It wasn't like.
Yes, it was like that. You know that. I couldn't talk.
Well, again, we're going to start wrapping it up here. If there are any other questions out there, please, put them out there. Let us know. We can ask Tammy. We really appreciate you doing this with us this Monday afternoon and sharing your story, giving us more insight on myasthenia gravis, as well as your diabetes and your journey. So what else would you definitely like to put out there and share for everybody?
I would like to say thank you. Thank you for giving me this opportunity to speak to you guys. Myasthenia gravis is rare, but there's a lot of autoimmune diseases that are rare. If you have any in your family, speak to someone, talk to your doctor. If someone is not listening, go to another one. If he ain't listening, start climbing that ladder. Just keep
look at that essence. We gonna work on that eating habit and working out.
Okay. Yes, indeed. Yes, indeed. We have to do that. I don't care if we get in a little group and say, okay, be accountable. You have to be accountable now for your actions, Tiffy. You have to be accountable.
Don't put me out
So
there like that.
you have to
Oh,
make sure you're hard on yourself. Make sure you eat correctly. Make sure you take your meds, and you will see a change. But you got to be that change, though. You have to, and don't base your experience based on somebody else's with diabetes, or well, this person not doing good, and I'm not. No, it's yours. You own yours, and make something happen.
all right. Any other questions before we kind of wrap it up? Keep advocating and let God guide you. Amen.
Amen. Always, always.
All right. Um, I think that's it. You got anything else to share?
Nope. If you have any questions for me, go ahead. You can hit my Facebook. I'm on Instagram and I'm also on TikTok. I'll be happy to help you. Maybe we can come up with some ideas to help each other. Like I said, this is something for the rest of my life. So we're gonna figure it out. We'll figure it out.
Perfect. And thanks everybody for tuning in. You can
Thanks,
always go
everybody.
back in and watch. So thank you, and thank you, Tammy.
Thank you. All right, bye.